All right. There we go. Thanks everybody for being here. I'm excited to see all of you all. I am Jillian Reese, Director of Carter County Drug Prevention. And at the beginning part of our meeting, we usually like to open the floor to anybody who has updates. If you have events or activities or programs that you want to share with the full group, you are welcome to do that now. So go ahead and share all of your cool stuff coming up with us.
Hey guys, this is Brittany Peeler from Johnson City Recovery Center. We are having our September fundraiser game night event on September 14th in honor of National Recovery Month. So that is going to be at High Point Clinic in Johnson City, September 14th from 6 to 10. We are going to have a silent auction. There's going to be a live recovery panel. We'll have food and refreshments, all kinds of stuff. I will put the flyer in the chat and we would love to see you all there.
Hello, everyone. This is Emily Matthews. I'm the Community Impact Consultant for the East and Northeast regions. And I just wanted to announce that our team has hired a Community Development Director, um, Dr. Angela Allen, and she is on the call today, joining in just to see how our Health Council works. So I just wanted to introduce her, and it's really great. She's a great addition to our team because she can really provide that additional support with seeking funding opportunities and getting grant ready. So I just wanted to introduce her, and then anytime you're asking me questions, I'm probably directing them to her to get the help anyway. So thank you for being here, Dr. Allen.
Hello, everybody. Tyler Wright here. Just wanted to remind you all that we have a Carter County Collaborative in-person meeting next Thursday, September 12th from 12 to 1:30 at the Carter County Health Department. If you're already getting my emails, great. Please RSVP for that. I'm going to be sending out another RSVP email after this meeting today. If you'd like to attend in person, we're going to have a lunch available. So RSVP through the link.
So I'll go ahead and share a couple updates from Carter County Drug Prevention. We have a couple trainings coming up. We're partnering with Uplift Appalachia to really try to support the faith community in Carter County and provide some trainings. So the first one is trauma-informed church training, and the second one is kind of an addiction 101 for churches. So I'm going to put the links to those in the chat if y'all are interested in them. And then we also have a cornhole tournament coming up on October 12th. So I'm going to put the link for that in the chat as well. And that supports our fatherhood programs. We also have the fatherhood support group on Thursday nights. So I'm going to put the link for all of that in the chat. Y'all please share that with anybody who may be interested. Anybody else have updates they want to share? All right, y'all are so quiet today. So we will go ahead and transition into our speaker portion of the meeting. As you all know, we like to feature a community partner at each of our meetings. And so today we have Allie Taylor, and she's going to share about Makeaway Transport and all of the awesome things they have going on. So I'll turn it over to you, Allie.
Awesome. Thank you, Jillian. Hello, everybody. I'm so glad to be here to be able to share a little bit more about Makeaway Transport. I do see some familiar names on here, so glad to see you all again. And I'm going to, if it's okay, share my screen just to give you a quick little overview of who we are and what we do, and hopefully be able to connect with more people outside of this to provide services through your organizations. So I'm going to Alrighty. So again, I'm Allie Taylor, and just to share a little bit about me, I actually reside in Knox County and started Makeaway Transport up in the Northeast area. At the time, I was working with an organization that provided wraparound services for pregnant women that struggle with substance use disorder. And we provided a lot of different services for them, which included transportation. And my role in particular was to connect with providers to identify this population and get them connected to the resources. And we would offer transportation to the moms or the moms to be. But what I was finding is that we were willing to pay for the services. However, there were no vendors to be able to support the population that we wanted to. So it was just a little bit daunting to go to provider after provider and hear that transportation was a barrier and we really didn't have a real solution besides the funding. So within that, I just kind of wanted to take some action there and just kind of stepped out on faith to say, we're going to do something. I don't know what that something is, but we'll start small. I purchased a couple of vans just personally and said I wanted to help the moms that.
Yeah, I don't want to wash down chicken. I'll get some coffee.
I think somebody's off mute. But yeah, so decided to just kind of get some vans and jump right in to help a few people. And surprisingly, there were a lot more people to help than I could handle. And then later on decided to just go ahead and expand and jump fully into the industry of non-emergency medical transportation to help those moms that we were serving, but then also expanding to anyone who had a barrier with transportation. So what we do is we provide non-emergency medical transportation throughout the Northeast region, Knoxville and surrounding, as well as the Middle Tennessee area. So Nashville, Murfreesboro, those different areas down there. We have a pretty broad range, and which allows us to do a lot of longer distance trips. People are going different places for specialty appointments, and so it's been really great to provide access to care through our services, whether it's local or long distance. And overall, we want to really decrease the barriers to healthcare with our services. We want to increase access. So like I said, no matter if someone is local or long distance, our vision is for everyone to have a way to get to their appointments. So I just want to talk about some of the travel burdens that we are experiencing, especially in rural areas. And I may be preaching to the choir to all of you because you all work in rural areas, but you all, I'm sure, are aware that it's a longer distance to travel to some appointments. There are some areas that may not have a healthcare facility right in their county, so they have no choice but to go outside of their city limits or their county limits for care. And if that barrier is there, more than likely what happens is that someone is just going to decide not to go to their appointments because it's either too far, they don't have their own mode of transportation, or it's going to be a really long day. So that's a deterrent there. And when people do miss their appointments, it has a huge impact on our community and on the overall health in our community. It increases healthcare cost. It delays clinical intervention. And so we want people to be going consistently to their appointments. But if they don't have transportation or the access is limited in their area, you're going to see things like lower patient retention, meaning that they may go to the first appointment and everything goes great for that first appointment, but that follow-up gets missed. You can't provide consistent care. Some other industry challenges that are not always at the forefront for everybody, but I wanted to bring it to your attention. First and foremost, that there is a negative reputation around non-emergency medical transport in general. So if any of you work directly with clients or patients that use transportation services, you might hear that they are not wanting to utilize the services because the wait may be too long to get there, or they may have experience being stranded before. And those are things that negatively impact any vendor because people are not wanting to sign up because they've had this bad experience in the past. There is a driver shortage, just like with anything, there's a shortage in finding quality employees, and everyone deals with that burden. And so that lends to the reason why wait times sometimes are longer, or different challenges that come about is because we are in need of more people who are willing to service their communities that want to do this type of work. Also, scheduling can be really challenging for the providers who are setting up these appointments, and even for the members themselves that are scheduling their own transportation. It can be time consuming to get on a phone call, go through all the prompts to set up a ride. And sometimes the information that's provided through the insurance or whatever the medium is does not get translated to the vendor correctly. So that causes communication breakdowns and being able to get their ride completed accurately, and just a lot of different challenges there. Like I mentioned, long wait times is one of the biggest issues, and we want to work together within our communities to try to prevent some of those things. And then in general, poor customer service has been a complaint of people that we have transported. They've called in to a call center to schedule the ride. The ride gets dispatched over to a different vendor, but they are not, the person on the call center, they're not privy to the local communities. So they're not aware of why it's important for certain information to get shared with the vendor. They're just not in the know. So they have experienced poor customer service. And we want to, again, do some things about that. So with Makeaway Transport, our goal is to be a transportation solution. We are not just looking to service just the member that's getting picked up and dropped off at their appointment. We're looking to be a solution for the entire community. We are all feeling the brunt of someone being able to miss their appointments, whether you are a provider or a member yourself. And so we want to work together in partnership to be able to come up with solutions that are going to help increase that access to healthcare. So just a quick recap of our services. We, as Makeaway Transport, we provide ambulatory care for the members that we serve. We serve the TennCare population, but we also partner with other organizations to serve people who do not have TennCare, whether they are uninsured or underinsured. We do work together with community partners to be able to provide access to more than just the TennCare population. These numbers are actually more now since we created the slide deck, but we average completing a little over 100 trips a day. And that's throughout all of our areas that we service. So one of the main questions that comes up often with Makeaway Transport is, where do we go? Where do we transport people? So again, as I mentioned, we do service mostly the TennCare population. And so TennCare will approve for someone with coverage to go to any appointment that is healthcare related. That could be their medical health, behavioral health, mental health. We do a lot of treatment appointments like dialysis or drug treatment. We do hospital discharges. We can even take people to fitness centers, different things that are involving health. And I always tell providers or even members that when in doubt, still attempt to send in to book your ride. And the worst that they can say is that we can't go there. But a lot more places than we think they are willing to approve for someone to get to. Now, some of the benefits, some of the benefits of working with Makeaway Transport is reliability. That is very important. And the way we're able to do that is by creating that partnership within the community. And so we really want to understand what are the challenges that your organization is experiencing so that we can curtail our services to fit what your needs are. So for example, we work with a mental health facility here in Knoxville that is discharging people who have been in the facility and they're ready to go home, but things come up. Sometimes people are just not ready to go for whatever reason. And we need to go against the industry standard to say, well, we'll wait more than that 5 minutes to make sure that you get picked up. We'll do some courtesy trips as we need to if a person doesn't have any family or just no ride to get there. Safety is very important. And so we have our safety checks that we do daily with our staff. All the staff have to have a background check. They go through extensive training to make sure they're prepared and ready to go to service our community. Convenience, that's all about creating that partnership and working with providers to see what their needs are. And partnership is very important for what we do. And communication, that is huge. People call me all the time. They call our team too to get things set up, but our team, we make ourselves available so that if anything goes awry, we can jump in quickly and be able to problem solve and make things work. And accommodating, it is important for our company to not be cookie cutter because we all have different needs for our organizations. And so we really want to connect and see how we can do that. How can we make this work? I'm very big on, I do not like to hear the word no. I don't know who does, but I like to always say, well, how can we? So rarely do I say to my partners is that, no, we can't do that. But it's okay, well, we may not be able to do it this way, but let's figure out how we can make it happen. I'm an innovative, being able to find new ways to reach our community, new ways to provide support, and again, making overall community impact. So our client base is not just our members that we take from point A to point B, it is our entire community. So we do want to connect with you and come up with solutions together. I don't have all the answers and no program does. And so that's why it's so important for us to be able to connect and see, well, what is going to work for each community. So Unified Care is one of the partners that we have that is our scheduling platform. And what they do is that they help streamline the practice of scheduling the trips and getting them booked and monitoring things. And so we partner with them because what we were seeing is that the partners that we had with healthcare facilities and things of that nature, they needed a really easy tool to be able to get their patients booked for discharge or appointments. They didn't have time to be sitting on the phone for 30 to 45 minutes just to schedule for one patient. And so we were able to partner with Unified Care to make it a very easy and simple streamlined process that takes the time, gives the providers the time back, and even gives the members time back if they are the ones booking their own appointments and their own transportation. So for anyone who is interested in learning more and being able to receive a training on how to refer and going a little bit more in depth, and so we can kind of understand how your organization works and what the particular needs are, I definitely encourage you to schedule a discovery call with me to where we can create that partnership and give access to referring through our platform so that you can start immediately booking trips for anyone that you service. But if you just can't wait to have a discovery call and you have someone who needs a ride and they do have TennCare, then you are welcome to go on our website to book a transportation trip. Very simple. The form is right on the website. You can fill it out and you'll get connected with a rep through Unified Care. And what they'll do is just confirm that all the information is correctly. get your ride set up, and they will be tracking and monitoring that ride for the duration of the trip. Just a couple of things policy-wise that we always like to share on the forefront is that for someone who does have TennCare, they do require that the transportation is booked at least 72 hours in advance. However, we know that's not always going to be the case. There's going to be discharge trips that happen within the day. Sometimes you're going to need something to happen much sooner. Things will come up. And we encourage you just to call directly in to say, hey, I need quicker service if it's possible. And we'll do our best to make that happen. Confirmation information does go out to the members. It goes out to the provider who submitted the transportation referral. And we do want to share that with patients. We do ask them to be ready at least an hour before their appointment. If they are going longer distance, it's an hour plus the drive time. So we want to make sure that if someone is going from Elizabethton to Nashville, that we have ample amount of time to get them there and plan for the unforeseen to happen. And the morning of the trip, they will get a call from the driver to share the ETA. So we encourage any providers that are submitting these transportation referrals to let their patients know that you will be getting a call from a random number and to make sure to answer so that we can confirm that they in fact do still want the ride. And any cancellations that come up, just let us know. That helps to create space for the next person who might need a ride. So I appreciate you guys letting me come on here and share a little bit more about Makeaway Transportation. And we do have our contact information here, and I'm sure it'll get shared out. And so I'd love to connect with anyone to get you all set up. Does anybody have any questions for me? Well, I look forward to connecting with anyone who is interested and being able to learn more about your organization and see how we can help with transportation there.
Thank you, Allie, for sharing. If you don't mind to put your info in the chat one more time, just in case anybody wasn't on when you put it in the first time. So everybody's got it. That would be awesome. Thank you so much for sharing with us and all the work that you're doing. So at this point in the meeting, I'm going to ask each of our committees to share a little bit about what they have going on. So always in our meeting, you get to pick which committee you want to work on. So, or if you don't want to work on a committee at all, that's also fine. So we have 3 options for everybody to choose from. And I'm going to ask each of our chairs of each committee to share a little bit about what they'll have going on today. So everybody can decide which one they want to join.
Hey, it's Tia with Committee A. So it's the Substance Abuse and Prevention Committee. And so today we will be talking about just how the overdose awareness events went across the region, and then any other upcoming events that we have that may need the CCC's support.
I do not think Committee B will be meeting today. However, they're going to be working on a lot of their stuff at the in-person meeting next Thursday. As far as Committee C goes, we're going to be talking a little bit about changing some of our objectives to be more based around blue zones. So if you're interested in blue zones, hop into Committee C today.
Hello, everyone. I wanted to make a quick announcement. I'm Victoria Runyon with UT Extension here in Carter County. And I wanted to let you all know that I'm actually leaving UT Extension and I'll be the new ag teacher in Hawkins County at Volunteer High School. So I'd love to partner with y'all there. This is my, tomorrow is my last day. September 1st of 2022 was my first day, and it was on a Thursday, and this was the first meeting I ever went to. So this is very special that this is my last event that I get to go to, and I've really enjoyed working here. I'm on Committee B, and we did stuff with gardening programs, so we've got that started, and I've passed those on, so I'm sure there'll be updates about that as well. Thank you all.
Okay, we are gonna miss Victoria for sure. So I'm gonna go ahead and open up the breakout rooms now. And as soon as the breakout committees are finished meeting, y'all are free to go. So thanks for being here. We appreciate all of you and the work that you're doing in our community. And we'll go ahead and open the committee rooms now.